Hi, it's Cynthia from Skincare at Fifth Avenue, and I'm one of the medical estheticians here with Dr. Joe, and we are actually going to be treating him today with our Hydrafacial MD machine. So Hydrafacial is one of our go-to treatments for most people because it offers a variety of things. With Hydrafacial, we are able to address acneic skin, if you have oily skin, if you're looking for more hydration, even people that have concerns with pigmentation, we're able to brighten and spot treat certain areas. Hydrafacial is your all-in-one. So you're getting a cleanse, you're getting extractions, you're also getting a wet microderm with the treatment. So you're getting that exfoliation. The serums that are used in the product are infused with a lot of peptides and antioxidants. So it feels really good on the skin. It's gonna help brighten, clean out those pores, and really just leave you with an overall beautiful skin complexion. So with Dr. Joe today, we're gonna do just our basic Hydrafacial, which runs at $150. We can add on boosters with this treatment, and that kind of determines the pricing. We also offer the LED lights, red and blue. So if you're struggling with acne and want to kill more bacteria, blue is going to be your go-to. Or for those that are concerned with anti-aging or just wanting, products to penetrate a little bit deeper if they have redness or irritation to the skin, we're able to target that with the red as well. Hydrafacial is a very easy treatment. It's very gentle on the skin. We just cleanse you twice. We also do a nice glycolic prep to the skin. It's a 7% glycolic, so it's not gonna leave you irritated. It's not gonna leave you peeling or flaky. It's just gonna help kill bacteria and help get ready for extractions. So we're gonna go ahead and start. Do you have any allergies to shellfish?
No.
Then we are good to go. So we're going to start with the Active 4 cleanser to help degrease the skin. It does have rosehip seed oil in it, so it's super gentle. It also contains algae, which is why I had to double check to make sure that he didn't have any allergies to that. After we cleanse with this, for our first cleanse, we are going to go to the Active 4 serum that's connected to the machine and do a second cleanse. All right, so we are going to go ahead and start with the actual machine. So the way Hydrafacial works is we're going to apply the serum. So as mentioned, I'm going to start with the Active 4 cleanser so we can get his second cleanse in. We're going to apply the serum with a simple dab, and then we're going to use the microderm portion of it and blend it into the skin. Okay. So we're simply going to dab the serum onto the skin, get it a little moist, and then light feather strokes to really help that product penetrate into the skin. Sorry, I know you can't really see. With Hydrafacial, you may get a little red post-procedure, but it will subside within the first couple of minutes after leaving. So what it's doing is it's sucking all the dirt and debris and that top layer of skin into the machine. Now they actually do have like a microderm tip, the purple tip, that they called the wet diamond microderm. Did you shave today, Dr. Joe?
Mm-hmm.
You might be a little sensitive.
I'm fine.
Okay.
I even had all therapy today.
You did. You did all the things. It's typically 3 steps. Well, 4 steps. But if they add on a booster, then it's 5 steps. So now we are going to do the glycol prep, which helps prep the skin for extractions. So with this, we typically only add it to the T-zone areas. I like to dab all over the skin, but it's just a light dab. We do not penetrate this into the skin with the suction. We just kind of rub it in. Any tingling?
A little, but not.
Yeah. Okay. All right, so now we're going to turn on our Beta HD, and that is going to help with the extraction portion. So it's just a extra cleanse, but we're going to focus only on normally like the chin, nasal, and forehead area. We are going to bump the suction up a little bit stronger on this step so that we can really get all the fun stuff out. All right, Dr. Joe, I won't be too rough on you.
That's okay.
You okay?
Mm-hmm.
Sometimes I'll like throw in the comedone extractor too, just depending on. All right, and then we're gonna turn that off. So we finish off with our Antiox, which is just a hyaluronic acid base. This also is just pressed onto the top of the skin, and we allow your skin to just kind of drink it all up to make sure that you're not dehydrated. We typically do 1 to 2 passes of this, just depending on how dehydrated your skin is. Okay, Dr. Jess, let me turn this way. I feel like this step takes the longest because you just literally kiss the skin with. So normally with a Hydrafacial, if your schedule permits and your budget permits, we do recommend to do them once a month. If that's not feasible for you, at least quarterly, so every 3 months, to get the best results from the treatment. All right, so we are finished with Dr. Joe. As you can see, he's left with a nice glow. His skin looks very hydrated. And what he'll do is follow up in 4 weeks for another facial. He does not have to stay out of the sun, but you do want to avoid working out for the next 24 hours because your skin, you don't want to overexert the skin. It can cause irritation. He needs to avoid using his retinol and vitamin C. Just stick with a gentle cleanser, a good moisturizer, and of course your sunscreen. And he's good to go. There's no limitations.